The 16th press conference of the Supreme Committee on COVID-19 Health signaled an increase of COVID-19 patients admitted in the intensive care units. His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health, member of the Supreme Committee on COVID-19, speaking to the media during the 16th press conference of the Supreme Committee today, said,
"Welcome to this almost weekly press conference. I will start with the numbers, and I hope these numbers will indicate or will tell us all how serious this matter is. Worldwide, there are more than 32 million cases, reported positive cases of COVID-19 disease. The death rate worldwide, or the number of deaths, almost 1 million. It's very sad to see video clips and messages from people who claim that they are healthcare professionals, or some of them may be politicians, denying the presence of this disease and still believing in the conspiracy theory. The disease is real, it is spreading, it is killing people everywhere. In Oman, yesterday there were 568 cases, which takes the total number of cases in Oman to 95,907, and that's a very huge number for us. Those who passed away, in total, 885. Yesterday, 10 deaths. We admitted in all our healthcare facilities 62 patients yesterday. The total admission is 512. Of the 62 cases, 9 cases in intensive care units, which takes the number to 185 patients of COVID-19 in our intensive care units. We reached a record about a week ago of over 190 cases. That's very much beyond our capacity.
His Excellency, the Minister, said perhaps we will have to resort to partial closure of some hotspot areas in the future. There is a clear disregard for social distancing and other rules in public places. His Excellency said the Sultanate is all set to open the first field hospital in 2 weeks, and 14 days quarantine is mandatory for everyone coming to the Sultanate. Regarding returning to schools, the Minister of Health said no one's life will be endangered, and these are directives of His Majesty the Sultan. Everyone should cooperate, as the cost of continuing school closures is also huge at all levels. Health Minister pointed out that 30% of COVID patients in intensive care unit have kidney failure. Regarding the increase of cases, he said the numbers do not mean that institutions have failed in their duty, but cases are increasing in the world, and it is overburdening the health sectors. His Excellency, the Minister, also said 2 weeks ago we lost a 37-year-old nurse. The Minister said the return of employees to work and opening of commercial activities are leading to the spread of the virus, but the main reason is the lack of compliance with precautionary measures and social distancing. Health Minister added that, "I call on all government and private agencies to adhere to the decisions and guidelines followed to limit the spread of the virus." There is a group that continues to hold parties in farms, rest houses, and closed places, and they gather in beaches and public places. Fingerprint system for employee attendance must be discontinued for now. His Excellency said since the start of the pandemic, a doctor and a nurse have died due to the COVID-19. He added deaths not just among the elderly or those with chronic diseases. We have lost people in the age group 15 to 17. The Minister said the number of COVID-19 cases among medical personnel is about 2,848, 42% of which are due to community transmission.